Good afternoon. My name is Amanda Brunner. I am currently enrolled in the Master of Science in Nursing Nurse Educator concentration at UNC Wilmington. This is the Nursing 597 Nursing Education Practicum 2. And this is my Evidence-Based Education Innovation Project presentation. My project is to teach staff nurses about non-pharmacological interventions for behavior problems, such as aggression and agitation in dementia patients. The need is present because of the large population of patients with dementia and the fact that this is a growing population. Also, these behavior problems are a consistent problem with dementia patients and cause a poor quality of life for the patient and the caregiver. Research actually shows that the percentage of dementia patients with agitation and aggression are anywhere between 13 to 33%. Not only do staff nurses need to know these interventions, but they need to be able to teach these interventions to family members who take care of their loved ones in the home setting. Pharmacological interventions are not recommended as first-line treatment and cause many major side effects such as falls risk, CVA risk, electrolyte imbalance. Most of us who have been in nursing for a while can remember when antipsychotics such as risperidone were routinely prescribed for dementia patients to handle behavior problems. We now know that this is an unsafe practice. We need to advocate for the patient if we see this as a current practice in our setting. For my project, I researched nursing care plans for dementia patients on a psychiatric unit that handles geriatric dementia patients. I researched nursing care plans for dementia patients with behavior problems and found very few or inadequate plans for the management of these patients with non-pharmacological interventions. I also, during my time with staff nurses, discussed the use of interventions and found a knowledge deficit and a need for education on this subject. I have started already, and I will continue to implement my project on a psychiatric unit. This is specifically at the Durham VA Medical Center that has a specific wing or area for dementia patients with aggression and agitation. The participants are staff nurses and nursing assistants. I am presenting the evidence-based practice through a PowerPoint and oral presentation. I am also introducing a care model called DICE, which stands for Describe, Investigate, Create, and Evaluate, and is based on a person-centered model of care for these dementia patients, and incorporates the interventions that I will be teaching. The interventions that I will be teaching are validation therapy, reality orientation, music therapy, pet therapy, and doll therapy. These are all non-pharmacological interventions that through research have proven, especially music therapy, to be helpful in giving these dementia patients a way to have a relationship with others, also a way to an outlet, and just usually they're either overstimulated or understimulated, and that's part of this person-centered care and the DICE model is to figure out what are the triggers for these behavior problems, and what could be causing these behavior problems, create a plan through the team members, present it to the provider, and do these non-pharmacological interventions and therapy, and evaluate if it has worked. I will assist with implementing this model of care, the DICE model of care, and follow up throughout the semester to evaluate understanding and success of its use. I have research peer-reviewed articles that support the evidence-based practice. And like I said, they do show that these interventions that are not through medications have been proven to be effective in keeping the agitation and aggression at least to a minimum with dementia patients. The learning theory that I am basing my teaching on is the social cognitive theory, because I will present information for the learners to store into memory, which is the cognitive theory part, and I will allow them the opportunity to learn from others through discussion and continued dialogue, which would be the social cognitive theory. I will provide a 5-question quiz and begin a discussion after my presentation to assess and evaluate learning outcomes. My expectation is for the learners to be able to answer all questions correctly, because it's only 5 questions, and participate in the discussion freely. During the discussion, I expect to hear about past experiences and how these can be added to the present information that was discussed. I expect for the participants to learn from each other. I also expect that they will continue to use the information learned and implement the DICE model of care in their practice. And I fully expect that the interventions will be helpful and add value to the patient's quality of life, and also the caregiver's quality of life, and also the quality of life while the nursing staff are on duty. That sums up my project, and I hope that my expectations will actually come true. Thank you.